Hi everyone, Dr. Jeff here this week with a new face. We've got Alyssa here with us this week. Mia's gone back to school. Alyssa's here for this term. So we're really excited to have Alyssa here. And actually she's going to be, I'm off to the World Badminton Championships tomorrow.
Ooh.
She's going to be here on her own next week, so be nice to her. So what topic do we have this week?
So in honor of Jeff leaving for the World Badminton team tomorrow, we're going to do badminton injuries. So what kind of badminton injuries have you had in your career?
Holy cow, I've had lots. I did my shoulder in, I did a rotator cuff in. That took a while to get better. I still really don't have my smash back yet with that. Tennis elbow was a big one.
Mm-hmm.
Changing grips on your racket, switching between feather and nylon birds. Get to the point where sometimes you can't even hold a cup or even shake hands. Not very pleasant. I had shin splints one time. That wasn't very nice either. That was a result of skipping on a hard surface. I started doing some more skipping and decided I can do it outside, and doing it on cement wasn't a good thing. You also get shin splints from changing shoes when I changed shoe sponsors. I went from Adidas to Puma, or Puma to Black Knight or other companies. You can get shin splints from changing your shoes. Patellofemoral syndrome, too much lunging. So my muscle on the inside got too weak, and then my muscle on the outside got too strong, and my kneecap started to shift too much to the outside, and got to the point where when I go to the net, my knee would collapse on me and I'd fall over. And probably one of the worst things I had was when I did my Achilles in.
Ooh, that sounds like a lot. I'm glad you're still alive and working.
Yeah. Well, after you play for 50-something years, these things happen.
Yeah, definitely. So let's dive deep into the Achilles tendon there.
Generally, when people come in with an Achilles, people think that it happens right away. They first start running, it happens, or they jump and it happens. It usually happens well into your game or well into your whatever you're doing. The muscle's nice and warm. It may be fatigued. That's why it happens. We really don't know. You kind of land funny. It always feels like somebody shot you in the leg or hit you with something, hit you with a stick. Like I know when I did mine, I kind of came down with my left one. I remember it was my left one now. I came down, I landed funny, went to push forward, and I felt this little sharp jab. And I'm looking around, I'm going, did somebody hit me with a racket or a bird or what happened? And then when I went to push off, there was just no power. It was quite painful. Kind of felt it right in here, and I couldn't really even walk very well. It was so sore.
Jeez. So you can rupture it fully or just partially, right? What are kind of the differences between that?
Yeah, so you can completely rupture your Achilles, and that's when the Achilles kind of pulls right off either off the heel or off the tendon junction here. It kind of rolls up in the back of your knee. As a practitioner, I can really tell if someone's done that because you just look at them, you say, oh, what's that big lump in the back of your leg? In that case, generally what they have to do is they have to do surgery on that. But otherwise, if you do it partially, like I did mine about 90%, you kind of tear it off the muscular-tendon junction here. They used to do surgery on these all the time. And what they're finding now is that the outcome, whether you do surgery or not surgery, is the same. So the majority of surgeons now don't bother doing surgery if you only partially tear your Achilles. Yeah.
Wow. So there's 3 muscles in there, right? How can you kind of diagnose which one's affected or what's going on there?
As you mentioned, there's 3 muscles there. There's one called the Plantaris. It's a really thin muscle. It's about, the width of your baby finger. You have something called your soleus, which is a flatter muscle. It's in behind your gastrocs. It's a bigger accessory muscle for going up on your toes and jumping. And then you have the big gastroc muscles, 2 of them, one on the inside, one on the outside. If you tear them or you strain them, they all look the same initially. When you have a plantaris, generally what will happen is after a week or 2 weeks or whatever, we get you to go up on your toes, and you can go up on your toes. If there's a soleus, then you're looking at maybe about a month before we get you going up on your toes. If it's your gastroc, that's your major muscle. It's going to take us probably 6 weeks to 3 months to get you going up and down your toes. We may not initially know exactly which one you did, but we know after a couple weeks we have a better idea which one you did, but we treat it all the same.
Cool. So what would be that treatment process?
A lot of the times if you went and saw the hospital or something with it, quite often they're going to want you put you in a boot. They've done some research on that, and they found that you immobilize a rabbit's foot, within hours, that rabbit's foot starts to show signs of arthritis. So putting you in a boot is not necessarily the best thing anymore. Quite often now, if you go in a boot, it's only going to be very temporary, only for the first week or so, or longer. We can get you in a brace of some sort, so you still have a little bit of movement in that. We get you on crutches. We don't want you walking on it because movement is what's going to get some blood flow to it. is the first thing you do is scar tissue. So scar tissue will kind of haphazardly put itself down. So the muscle wants to go this way, scar tissue wants to go any which way you want. So one of the things we do after a little bit of time is we're going to try and break that scar tissue up. So one way we can do that here is I'll do some ART or active release therapy. So I'm taking your foot and I'm actually bending it back and forth, and I'm trying to find where that scar tissue is, and I'm going to try and knead it out and try and break it up. One thing we do try and do, as soon as we're able to get you on a bike, we try and get you biking, again, to try and keep your cardio up. Also get a little bit of movement in there. Once we do get the scar tissue going, then we can do some shockwave on it. Shockwave is a big thing for trying to, again, help break up that scar tissue and how to repattern the tissue in a better way. And of course, lasers. Lasers good for any time you do some scar tissue and stuff. I do remember when I did my calf, and our doctor kept hitting me on the Achilles looking for a reflex. My foot kept bouncing, and stop that, that really hurts. And he says, I'm just checking for a reflex. I said, there's a reflex, like it really hurts. So if we test a reflex and you have a reflex, that means you didn't rupture your Achilles, you still have something there. I had some massage on it. I was also a new chiropractor, so I didn't have a lot of patients happening at the time, so I had lots of time to go to the gym and riding the bike. I had my own stimulator and stuff, so I was putting it on every day and taking it home at night and doing all the stuff I needed to do. And it took me, I think I did mine in November because I was playing in Toronto, and I was back playing in time for the Nationals, I think in April. Most people will find with a Plantaris, it's going to take us probably maybe 6 weeks to get you back to your activity. With a soleus, you're looking at about 12 weeks to get back to your activity. Gastroc, you're looking at between 6 to 12 months, depending on how aggressive you are with your therapy. Again, once we get things moving, you can always see a physiotherapist, and they can really get you on an exercise program to get the strength back in it. But there's certainly things here we can do to speed up the recovery.
That's amazing. Well, that's what we have for you guys today. I hope you enjoy our video. As always, feel free to subscribe and smash the like button down below. If you have any comments or recommendations for our next video, you can leave that down below as well. And as always, here at Goldsworthy Wellness, we've got your back.